Autism spectrum disorder has been found in all age, racial and socioeconomic groups, but as many as 1 in 4 cases go undiagnosed. A large number of adults have mild forms of autism that fly under the diagnostic radar for years. These milder cases might only have a small number of symptoms, or may have learned to suppress symptoms in a way that makes them harder to identify. If you recognize certain symptoms in yourself or the people around you, it could be worth pursuing an assessment through your GP or a specialist. The NHS reports that common signs of autism in adults revolve around how you interact socially with other people. You might find it hard to understand other people's thought processes or emotions, or struggle with communicating your emotions to other people. Many autistic adults struggle with maintaining the implicit give and take rhythm of a conversation, either withdrawing from a discussion or going on monologues and tangents. Other symptoms include holding rigid routines or repetitive behaviors and exhibiting strong niche interests. Omicron symptoms, 7 early symptoms to spot and why they differ from the Delta variant. One study published in Brain Sci suggests that women are more likely to be misdiagnosed when being examined for autism. Some researchers speculated that women are less susceptible to developing the condition, but others have raised the possibility that symptoms are less likely to be recognized in women. Symptoms of autism that make you less communicative are more likely to be attributed to gender rather than neurology. The NHS notes that autistic women may be quieter and better able to hide their feelings, making it more difficult to diagnose them. The longest you should go without showering during winter, expert issues warning, advice, strictly star praised for normalizing health condition leaving fans in tears, insight arthritis, 4 foods that are big inflammation triggers, how to avoid joint pain, tips, the longest you should go without showering during winter, expert issues warning, advice, strictly star praised for normalizing health condition leaving fans in tears, insight, arthritis, 4 foods that are big inflammation triggers, how to avoid joint pain, tips. It is common for people with undiagnosed autism to receive a diagnosis for some of the symptoms they present. A 2019 study revealed that more than 10% of autistic adults had previously been misdiagnosed with ADHD as children. Symptoms of autism might also be attributed to conditions such as OCD or social anxiety disorder. Such a diagnosis might go unquestioned for years afterwards. If you believe you are autistic, the NHS recommends that you pursue a diagnosis through a doctor or therapist. Understanding the condition and being diagnosed can give you access to resources and support that improve your quality of life. The BMA reports that waiting times for diagnosis have increased significantly in the past several years. Freedom of Information requests have revealed that less than 10% of people in England receive a diagnosis within 3 months of speaking to their GP. Autism can predispose you towards mental health complications, and autistic people are more likely to require mental health services. A study in the journal Autism surveyed 500 psychotherapists in Germany and revealed that many had not been given training to diagnose or treat autistic patients. Many were revealed to have outdated or incorrect information about autism that could limit their ability to provide help. Some studies have attributed the pervasiveness of misinformation about autism to how it is represented in media and fiction.